Right, so let's have a little chat about some mental health patient-reported outcome measures. There's quite a number of these that have been created. The ones that I'd like to have a look at is the DAS, the Depression, Anxiety and Stress Scale. I want to look at the GAD-7, which is the Generalized Anxiety Disorder Questionnaire, so specifically for anxiety. And then there's the HADS, the Hospital Anxiety and Depression Scale, and the Beck Anxiety Inventory. So these are all reliable and valid patient-reported outcome measures for mental health problems such as anxiety, depression, and stress. So this is what the DAS-21 looks like. So there's a short version and a longer version. The full DAS is a 42-item self-reported instrument designed to measure 3 related negative emotional states of depression, anxiety, and stress. So if you add in here, this is the outcomes. So each of the different questions either are a question about depression or anxiety or stress, and you can get a scale for each of them. So the DAS questionnaire, it's again in the public domain, so it's free. Again, it's very quick and easy to fill in, and you can follow over time again and see, is chiropractic care changing your patient's perception of their depression, anxiety, or stress? Very, very important thing to track. The GADS is slightly different. It's a shorter version. It's only got 7 questions that you fill in instead of 21 or 42. So it's a shorter version. If you want to go for short, quick, and easy, you can go with the GAD. Again, in the last couple of weeks, have the following been bothering you? And then you go, not at all, yes, or more than half a day, or almost every day, right? So nothing to quite a lot. So very, very quick and easy again, reliable, valid questionnaire specifically about anxiety. So if that's a key problem for your patients, maybe you want to go with a GAD. So the depression and anxiety scale, again, measures both depression and anxiety. Whereas remember, the DAS is depression, anxiety, and stress. So you can look at all 3 of those. But this HADS is, again, valid and reliable. It's a very, again, quick and easy screening tool where they would rate themselves on these different key questions from not at all to most of the time or very bad, right? So again, 0 to 1, some of them are about depression, some of them are about anxiety. Real quick and easy to fill in again. And again, a great tool to measure over time, how are your patients improving when it comes to anxiety and depression. So on the scoring here at the bottom, if you have a look at that, so 0 to 7 would be considered normal and not something you need to worry about. 8 to 10 would be considered borderline abnormal. Borderline probably are a real significant case. And if they score 11 to 21 in either the depression or the anxiety, then it's considered quite a severe case. It's something that you've got to take seriously. So well worth, again, measuring. And then you've got the Beck Anxiety Inventory. So there's quite a few different options that you've got for specifically for anxiety. So this Beck Anxiety Inventory enables clinicians to measure the severity of anxiety, and this one goes down to adolescents as well, not just adults. So you can screen anxiety in this 21-item scale, again, from not at all to very severe, and each is descriptive, so it's how they find their anxiety. Again, an easy way to measure and monitor the outcomes in your patients. Each of these, if you wanted to use them, you can find them online. You can just Google search them, put the name in and then write PDF, but you can also Google search how to score them. So there's specific ways. I haven't gone into all the details on all of them. I just wanted to introduce you to all these different forms. I mean, on this one, I'm assuming, I don't know for sure, but I'm assuming that you literally just, I know the others quite well, how you rate them, but this one, I'm assuming you just get a number, right? So out of those 21 items, and there's 0 to 3, then you can see 21 times 3 is the maximum you can get, and you can get an idea of how bad they are depending on that number. And getting that number down is obviously the idea. So I want to move on now to talk a little bit about the value of participating and getting your patients to fill in these patient-reported outcome measures. But before I do that again, just pause, test yourself on these mental health problems.